Hello, my name is Maansi Barnwal, and I am a junior majoring in public health and psychology. I'm a volunteer research intern at the Kennedy Krieger Institute Center for Neurodevelopmental and Imaging Research. Under the guidance of my PIs, Dr. Stuart Mostovsky and Dr. Carrie Rush, and in collaboration with my mentor, Alyssa Deronda, I studied emotion dysregulation and social skill difficulties among youth with attention deficit hyperactivity disorder, or ADHD. ADHD is a childhood disorder most known for causing symptoms of hyperactivity, fidgeting, impulsivity, and inattentiveness. But lesser known is the emotional component of this disorder, a symptom called emotion dysregulation, which is the inability to control shifts in one's emotions and express emotion that is appropriate for a situation. In addition to experiencing emotion dysregulation, youth with ADHD also experience difficulties in social settings. They have a harder time making and maintaining friendships, and they are at a higher risk of peer rejection compared to their neurotypical peers. The goal of our study was to examine the impact of an ADHD diagnosis and emotion dysregulation in childhood and determine if these could predict social skill difficulties in adolescence among youth with ADHD. To do this, we had parents of children with and without ADHD complete questionnaires about their child's emotion dysregulation symptoms. The questionnaires included 3 emotion dysregulation measures, which assessed irritability, frustration, emotion regulation, and lability and negativity. These children then came back to the center when they were adolescents, and their parents completed another questionnaire about their teenager social skills. From our data analysis, we found that diagnosis had a significant main effect on emotion dysregulation in childhood and social skill difficulties in adolescence. We also found that for the affective reactivity index, which assesses irritability and frustration, there was a diagnostic and sex interaction in which parents of males with ADHD reported that their child had higher levels of these symptoms than parents of males without ADHD and even parents of females with ADHD. We then used Pearson correlation to determine that higher levels of emotion dysregulation were significantly associated with lower social skills, and this was true across all 3 of our parent-reported emotion dysregulation measures. We finally used multiple linear regression models to see whether emotion dysregulation in childhood was predictive of social skill difficulties in adolescence beyond just an ADHD diagnosis. In all of our analyses, we found that diagnosis was a significant predictor of lower social skills in adolescence. But we also found evidence that score on the emotion regulation checklist, particularly the emotion regulation subscale, was a significant predictor of lower social skills in adolescence. These results suggest that parent-reported emotion dysregulation in childhood and an ADHD diagnosis are strong predictors of less parent-reported social skills in adolescence. Future research should consider incorporating childhood measures of social functioning to assess whether these relationships are solely longitudinal, and youth-reported social functioning measures should be used to better assess social impairment. Thank you.